I'm Dr. Lisa Matriste. I'm a dentist at Laser and Holistic Dental in Melbourne. The current options for treating sleep breathing disorders are the CPAP machine, weight management, Mandibular Advancement Splints, and more recently the NightLase treatment. CPAP is recommended for severe sleep apnea. It's very effective in patients who are able to tolerate it. Unfortunately, not many people can. Mandibular advancement splints are effective for snoring and mild or moderate sleep apnea. Unfortunately, in a high proportion of patients, there can be some permanent bite changes and some strain on the jaw joint. For these reasons, many patients prefer NightLase treatment over the conventional options. NightLase is a quick and comfortable procedure that's well tolerated and highly effective.